WFNZ.
Live from Studio A at the Cumulus Broadcast House, it's Health View with your host, Dr. Angela Ruff. Your information leader for more than 65 years. News Talk 640.
WFNZ.
Good morning and welcome to Health View. This morning our guest is Dr. Richard Weisler. Dr. Weisler has been in private practice in Raleigh, North Carolina since 1980, where his group currently follows more than 2,000 patients with a mixture of psychiatric problems. He is an adjunct professor of psychiatry at the University of North Carolina Chapel Hill School of Medicine, where he also serves as chairman of the board of visitors for the Department of Psychiatry. Dr. Weisler also is adjunct associate professor of psychiatry and behavioral sciences at Duke University Medical Center in Durham, North Carolina. Dr. Weisler received his residency training and medical degree from the University of North Carolina at Chapel Hill and received his undergraduate degree from Tulane University in New Orleans, Louisiana. In 2007, Men's Health magazine, working in conjunction with Castle and Connolly, selected him as the top doc for men among all psychiatrists in the United States. Castle and Connolly also named him one of America's top doctors for 2006. The Consumers Research Council of America also named Dr. Weisler one of America's top psychiatrists for 2002 and 2003. His physician peers have annually selected Dr. Weisler as one of the best doctors in North Carolina. In 2005 and 2006, he was listed in the Who's Who Among Medical Professionals publication. In addition, he is a past recipient of the Outstanding Teacher Award from the UNC Chapel Hill Psychiatry Department. His research and work frequently have been featured on national television and radio shows, as well as in several magazines. In 2006, a feature story in Oprah magazine highlighted his group's research into environmental chemical exposures and a potential link to suicides and cancers. Dr. Weisler's group's groundbreaking research, which hypothesizes a possible environmental pollution link to death by suicide, was also covered by the national and international press. Dr. Weisler is also credited with first identifying the usefulness of Lamictal in bipolar disorder when in 1993 he presented a report on his successful treatment on a compassionate use basis of 2 severely treatment-resistant bipolar patients with then unapproved drug in the U.S. for any condition. Dr. Weisler's theory and clinical observations about Lamictal's positive impact on depressive symptoms and mood cycling in those patients helped propel the ensuing research that led to Lamictal being approved in 2003 by the FDA as the first new drug for the maintenance treatment of bipolar disorder in 30 years. Dr. Weisler is board certified by the American Board of Psychiatry and Neurology. He has been the principal investigator in about 200 clinical trials. Dr. Weisler has authored and co-authored more than 55 journal articles and book chapters on bipolar disorder, attention deficit disorder, depression, PTSD, social phobia, dementia, pharmacoeconomics, suicide, and generalized anxiety disorders. In addition, he has been very actively involved in the development of many of the currently approved and investigational treatments for bipolar disorder, major depression, attention deficit hyperactivity disorder, social phobia, post-traumatic stress disorder, generalized anxiety disorder, obsessive compulsive disorder, dementia, sleep disorder, and migraines. He also has conducted research in the areas of neuroimaging and the genetics of psychiatric disorders. He has served as a peer reviewer for many scientific journals, including Journal of the American Medical Association, Biological Psychiatry, Journal of Affective Disorders, and the Journal of Clinical Psychiatry, among others, as well as for the Agency for Toxic Substances and Disease Registry. So, Dr. Weisler, that's a long intro, but thank you for taking time of your obviously very busy schedule to help discuss post-traumatic stress disorder.
Well, Angela, thank you so much for having me, and I'm very excited to talk about this topic, and it's particularly important right now. Post-traumatic stress disorder is a very common disorder, as unfortunately people do go through a number of traumas in their lifetime. And especially in the current environment, we know military mental health needs are also very great, both for our veterans and also for the families. So I definitely want to talk about that some, too, as we go through things today.
Well, what is exactly post-traumatic stress disorders?
Well, post-traumatic stress disorder requires a few key criteria. So definitely one of the essential features of post-traumatic stress disorder is that the person has to have been exposed to a traumatic event. And after being exposed to a traumatic event, you need both of the following things to have occurred. The person would have witnessed or experienced or be confronted by event or events that involved a threat of death or serious injury, either actual or just the threat of it, or a sense or fear of a threat to the integrity of themselves or others that they're close to. And in addition, you'd have to have the person's response involve intense fear. So that fear could be helplessness, it could be horror-type feelings. And in children, sometimes it shows up more as disorganized behavior or agitated behavior. So then once you have that, those key criteria, which, by the way, a large percentage of the country at some point in their life will go through something where they'll have traumatic events. It could be automobile accidents. It could be clearly a natural disaster like we've had in North Carolina with hurricanes or tornadoes. It could be car accidents where people may have been hurt. Unfortunately, there's too many people have been abused sexually or may have been assaulted. So there are lots of different situations. But then once you have the traumatic event, in the first month after it, we would talk about what we call acute stress disorders. And the acute stress disorders, as well as post-traumatic stress disorder, involve, again, other kind of symptoms in terms of how people deal with stress, traumatic stressors. So with post-traumatic stress disorder, people will continually or persistently re-experience the trauma. And they do that in one or more ways. So sometimes it would be recollections of the event, images, thoughts, perceptions. Again, with children, what we might find is that they may repetitively play a game or color or talk about a story. And I've seen that some in New Orleans with some of the work we've done down there post-Hurricane Katrina. And they'll also have distressing dreams, perhaps, about the event. In children, again, the dreams may be frightening as well, but they may not remember the content, per se.
Right.
People may act as if they're reliving the event. It could be illusions or dissociative flashbacks, feeling like it's occurring again, and they can sometimes occur when people are awake, or even sometimes people will drink alcohol too much to try to get rid of these feelings, but they can occur then too. And children will just reenact it, what happened. They'll worry a great deal about that. Other things that might occur would be that if they have cues that may symbolize or resemble an aspect of the traumatic event, they may get upset again. So, for example, here, right now, we've had some thunders going on outside, in case the listeners hear it.
Right.
And when I was doing some work in New Orleans recently, there was a thunderstorm. Well, some of the people that I was talking to who had been so heavily impacted by Hurricane Katrina, and they'd lost their houses, sometimes lost loved ones, when the thunder occurred, you could just see the terror in their eyes. They would re-experience what they had been through before. You hear the same thing sometimes when, soldiers will hear a loud noise or something that may sound like an explosion or a gunfire or a surprise, something may surprise them, they'll be afraid. And when that happens, then you can get what we call a physiological reactivity on exposure. In other words, your heart rate may begin to increase. You may be hyper acute responses there physically as well. Another key symptom is what we call avoidance. And so after a trauma, people often avoid things that remind them of it. They may feel numb, something that wasn't present before the trauma. And some of those things would be they'll try to avoid thoughts, they'll try to block out feelings, they'll want to talk about what happened, they'll avoid the place where it happened or activities, any people that may arouse recollections of the trauma. There may be problems as well with an inability to recall what happened, during the trauma, even though they didn't have necessarily a head injury in an automobile accident or in a war-related change. They may just not be able to remember, kind of have a blank for a period of time. There's often a diminished interest or even participation in activities, so things that they might have really liked, perhaps like gardening or liked driving a car or riding a bike or whatever it might be. Their interest in things may go down dramatically. So, again, people that may have been injured in a particular setting may be especially afraid of that.
Right.
There'll be a sense of detachment, what we call estrangement as well, where even though they've been close to people for many, many years or long periods of time, they suddenly feel very distant, can't connect, feel all alone. That ability to have loving feelings can be a problem because you numb yourself so you don't have to feel as much. The arousal is so great sometimes with post-traumatic stress that I think that makes it very difficult. And we'll talk in a minute again about the military situation as people come home from the war and how that may be impacting people there too.
So do you think is there any chemical involvement here? Or is it...
there's definitely both psychological involvement, sociological kind of things, as well as biochemical changes that are going on. And then when they get this sense, they also will feel like they don't have much of a future, perhaps. They think they may not have a long career, maybe not a long marriage, not a normal lifespan. They worry about all sorts of things. And accompanied by that are what we call persistent symptoms of arousal. And you have to have a couple of these as well to have PTSD or post-traumatic stress disorder. So it'd be trouble falling or staying asleep, irritability or outburst of anger, trouble concentrating, hypervigilance where you're on guard, kind of like you're on watch all the time,
right.
And an exaggerated startle response. And then you have to have these symptoms for more than a month, and they have to cause you significant distress or impairment at either home or work or other areas of function. So typically, when you go through a trauma, and we don't understand why, but we know that biologically, some people can be in an identical situation. They'll be riding in the same car. There might be an accident, and one person in the car may develop PTSD, and the other person who's in the exact same car went through the same experience will have no trouble. In the military setting, we know that some people, all very strong people, will be in an identical situation as part of a squad or something in that area. There may be an explosion of like an IED, and one or two people may develop PTSD, and the other people in that same setting will not develop PTSD. And we think then there's a genetic vulnerability that may place people at risk, perhaps past exposures, how they've learned things. And we certainly have seen that in New Orleans as well, the work we've done. And we saw it in North Carolina after Hurricane Fran and Hurricane Floyd. But these are fairly common disorders, like I said. So it may be as many as 8% of the population to maybe even 10% may develop it during their lifetime. And it can be, it can go away and resolve sometimes spontaneously, often with treatment after the course of several months to a year, and then other people will have it chronically. We still, as you know, in the Veterans Administration hospitals have, and the outpatient clinics have lots of people who are still dealing with it from Vietnam era or even World War II for some people. And, talking about the current situation, and especially with a radio station that's based in the Fayetteville area, we know that military mental health needs are very important. So just to give the readers and listeners a general feel, there have been about 1.6 million people who've been deployed as part of Operation Enduring Freedom in Afghanistan or Operation Iraqi Freedom. And when they've looked at people, and the RAND Corporation, R-A-N-D Corporation, did a very nice report that's available on the web, and it's free. And they looked at what happened after deployment, and what they have found, as well as other people have found, is that the pace and length of deployment and the frequency of redeployment have been, an unprecedented almost in the history of the all-volunteer force. And what's different in this war and other wars is that, fortunately, because of better medical care and better body armor and things like that, we have more people who are surviving injuries.
Right.
In contrast to what happened in World War II, where it would have been, a little bit like around 2.2 people would be wounded for every person who may have died.
Right.
And then in Vietnam, it was right around 3 people who were wounded seriously for every person who died. And these are rough numbers. And this war, it's very different. So we have a lot more survivors, but as a result of that, we're also seeing higher rates of post-traumatic stress disorder.
Right. We're just going to take a quick break to hear from our sponsors, and when we get back, I certainly want to hear more about how our current group is some good coping skills or some hopefully some solutions to help them solve that. You're listening to WFNC News Talk 640. This is Dr. Angela Ruff, and again, our guest this morning is Dr. Richard Weisler.